Can grab anyone. And opiate addiction, especially heroin, is a huge problem here in Baltimore. One estimate lists the number of heroin addicts in the city as high as 60,000. But people in Harwood and the Midway community say they are oversaturated and targeted with these treatment centers. Right now, a third methadone clinic is under construction in Harwood.
Jamie, the developer of the project, says this clinic will be different from any other drug treatment facility in Baltimore, adding that it'll be a positive addition to the community. But people who live in the area say another clinic would cripple an already struggling neighborhood.
We know we have drug problems in this town. It's more than obvious. There are neighbors, there are friends, there are families. We just need it to get better. We need people to get better.
It's perhaps the one thing everyone can agree with. Baltimore needs good, effective drug addiction treatment. But where these places go is often the subject of debate. Construction continues on a new $1.4 million clinic in the Harwood neighborhood in East Baltimore. It's being built on East 25th Street near Greenmount Avenue. Rob Mara lives around the corner. He and many of his neighbors say enough is enough.
We felt this is too much. We're already inundated with centers, and centers that have open slots available for people who need treatment.
There are two methadone clinics within a mile of the new clinic's location, both on Maryland Avenue. And within the clinic's 21218 zip code, the Department of Health and Mental Hygiene lists close to 24 drug treatment and counseling resource programs. Linda Johnson, president of the Greater Greenmount Community Association, shares Mara's concerns.
We're not against helping people that are addicted. The concern, again, is the saturation, the number of these programs in our community, in a community that's already struggling, that border other communities that are struggling.
Over the past year in development, the project faced several challenges from city council members and community groups, and a controversy over the clinic's developer paying protesters to demonstrate in favor of the clinic at a community meeting in July.
Put this on your knees, man. They want to try and pay us.
Everybody's going to get their money.
I'm still very angry at any healthcare provider who gives cash to some of the most vulnerable people in this city, addicts, to attend our open meeting, because we know where that money went.
Reimbursing people a nominal amount, I don't think is the story.
That was Concerted Care Group President and CEO Noah Nordheimer. At the time of the protest, he argued the company simply reimbursed people for the inconvenience. But in the long run, Nordheimer says he wants his clinic to help the neighborhood get stronger, not hurt it.
We've had a lot of community involvement. I think that there's people from other communities who would like that to be their perception. But if you spend enough time in this neighborhood, they know us on a first-name basis. We're here every day. There isn't a day that goes by that someone doesn't approach me asking when we're open. And we're excited to be here.
The clinic's chief medical officer, Dr. Devesh Kandrapane, says this clinic will be a first for Baltimore. Clients will be able to receive drug treatment, primary care, and mental health services all under one roof.
If we provide to them something that's integrated in one location, I think that, along with health home and coordination of care, you can do phenomenally well in helping patients to succeed.
The clinic also plans to have primary care hours open to the community, with the capacity to treat up to 2,500 patients a year.
The community will, at the end of the day, tell us what type of a need there is. We want to just communicate that it is there for those who do need it.
Though they will likely not be able to stop this clinic from opening, what Mara and Johnson find even more troubling is what they view as a lack of regulations over where drug treatment centers are located.
So far as I know, it's easier to open a clinic than it is a bodega in this town. And that in itself is an issue.
They and others are working on crafting legislation that they are planning to present to the General Assembly. They would like the state to exercise greater authority over the locations of opioid treatment clinics to ensure that these clinics are closest to those who need them and are not concentrated in one particular area. In the case of the clinics in the 21218 zip code, they argue the Department of Health and Mental Hygiene statistics show that 82% of the clients those treatment centers serve live outside of the zip code.
We have to work with the Americans with Disabilities Act so that treatment centers are providing the best service for those who need it and where they need it.
But David Tanner, executive director of the city's Board of Municipal and Zoning Appeals, says the Americans with Disabilities Act will pose a significant challenge. Those protected by ADA include recovering drug addicts.
The federal court, all the way up to the Supreme Court, said the local governments can't treat drug abuse treatment centers any differently than other medical type uses.
Nordheimer says he's committed to showing the community that the clinic will be a good thing for Harwood and easing concerns about increased crime and drug activity around treatment centers. The clinic will have a large waiting room so that groups of people aren't loitering outside of the building. The plan is to also have off-duty police officers patrolling inside and out.
Our research tells us that people in recovery commit less crimes, they get jobs faster. We are going to be tracking through our electronic health record system 911 calls, ER visits, and show how a positive impact, what a positive impact we will be on the community.
But for people like Mara, who lives just a short walk from CCG's new clinic, it's going to be a tough sell.
Another poor neighborhood doesn't need this. It's trying to turn its property tax base around, its economic tax base around, and that's how the neighborhoods get better. We need to not have more people coming in for treatment into this neighborhood because we're already struggling and struggling mightily.
Nordheimer says the clinic will create about 70 new jobs. He hopes to open up by the end of the year.
But Trang, there are other obstacles. There are some problems here, right?
Yeah, that's right, Jamie. Baltimore City Council members Carl Stokes and Mary Pat Clark proposed an ordinance back in June to rezone the clinic's buildings that would bar their use as a clinic. Now, that ordinance is in committee, and the Central Baltimore Partnership appealed the city's permit to allow the clinic's construction. But though the zoning board did uphold that decision, the partnership has 30 days after receiving the decision to take the matter to circuit court. So there's lots of stuff still going on with
And
this.
you're going to follow all that stuff. And, we spend massive amounts of money on clinics and rehab programs to try to break addictions. But feeding an addiction can be just as costly. We have a photo gallery and the numbers on the 5 most expensive addictions waiting for you right now on our website at abc2news.com.